There have been a lot of developments since the very beginning of the COVID-19 pandemic, and lately, a lot of questions have also surfaced, especially in regards to CHSLDs, long-term care facilities, and about the safety and protection of workers working within those facilities. To help get some answers to those questions, joined by Dr. Leighanne Parkes, infectious disease specialist and microbiologist working with infection prevention and control at the Jewish General Hospital. Dr. Parkes, thanks for joining us.
It's no problem.
Why don't we begin by where we're at right now? It's now been a few months since the very first confirmed COVID-19 case. What have we learned about the virus and how it's transmitted?
We've learned quite a bit. So we in North America have kind of had it easy in terms of getting the outbreak a bit later than the rest of the world. So we've had the advantage of having 5 months of accumulated data from an epidemiological standpoint, as well as from clinical experience standpoint and scientific study standpoint. So we really do have a lot of new information that we didn't have when we first saw the cases back in December in China. And what we've learned a lot is in relation to how the disease is transmitted. So we now know that the disease is transmitted largely by droplets. So droplets are particles of secretions from our respiratory tract, as well as virus or bacteria, that are expelled from our mouth or nose when we sneeze or cough or exhale. Now, these are a size that is big enough that they're brought down to the ground by the force of gravity. So they can't really travel very far without falling. It depends on the size, their weight, and the velocity with which they come out of a person, but usually it's less than 2 meters, and by that time they rapidly fall to the ground. The question is, how does this get into other people? Because we kind of have one half of the equation, which is how the virus gets out of a person who has an infection, which is via these droplets. So the way that it gets in, the portal of entry, is either from these droplets landing directly into our ports of entry, which are our eyes, our nose, or our mouth, or they fall down onto one of these surfaces in this circumference around people, and we, with our hands, touch that surface, and then we rub our eyes, our nose, and our mouth. And through that, we end up having a link in a chain of transmission from an infected person to a person that gets infection. Now, in medical settings, there is what we call an accessory pathway. So this very uncommon way that the disease transmits. And that's through aerosols. So aerosols differ a little bit from droplets insofar as they're smaller. And because they're smaller, they can hover in the air for a period of time. And as they hover in the air, the virus remains viable hovering in the air. But we don't really create droplets on our own. We can't do this naturally. It's more of an opportunistic production. So we create droplets by intubating patients, by putting tubes down to help them breathe, by pressing on their chest to resuscitate them, by suctioning their airways, or if they have a tracheostomy, a hole in their throat for breathing, and by using specific types of tubes to take a look into the lung, bronchoscopy. So when we do that, we can generate these aerosols. So we call them aerosol generating medical procedures. And in those instances, these can be breathed in by people in close proximity during the time that these procedures are formed. So those are really the links in the chains of transmission. So knowing this is extraordinary, because half of the work in infection prevention and control and in controlling outbreaks is knowing this transmission process. Because if we know it, we can break those links. And the way we can break the links is twofold. One, we prevent any exit of the virus from the portals of exit. So we cover the nose and the mouth of patients or people that have the virus. And point two is we cover our portals of entry. So we can do that by putting a mask over our mouth and nose and a protection over our eyes, like a visor or goggles. So for those processes where droplets are produced, and which is the vast majority of cases, using a surgical mask and goggles or eye protection can protect us very, very well. And the second thing we do is we protect the surfaces including our surfaces and our hands, using gown and gloves. So having that knowledge, I think, has been very helpful. And it has changed a little bit over time how we've acted, because we've really had a good, very rapid and progressive learning curve to help inform our current practices.
Right. Now, looking back over the last few weeks, the directives have changed quite a bit. Why do you suppose that is exactly? Is it because we're running out of inventory, certain equipment, that kind of thing?
So things have changed very rapidly from the very beginning of the outbreak. As we gain more knowledge, we alter the way we act. And this is very normal whenever we have something that we learn something new about. So a lot of this is a reflection of new knowledge, of new experience, and of new evidence. And some of it also is related to shortages, and this is at a global scale. What we focus on is using our materials and the materials we have in a judicious way. And, irrespective of the situation, we should always do this. So this is definitely something that contributes to some of the changes. But the real motivation behind all of our recommendations is to maximize healthcare worker safety and patient safety.
Dr. Parkes, let me ask you about the differences that may or may not exist between facilities. This is a question that I've seen come up. For example, does the hospital have different directives versus a CHSLD, for example, when it comes to personal protective equipment?
Yeah, so really the personal protective equipment is kind of what I described at the very beginning, as a means that we can protect ourselves as healthcare workers during the encounter with a patient. And for droplets, which is kind of what we see, or what we do know is the mainstay of transmission for this virus. That includes a gown, gloves, the surgical mask, and facial protection. So the either the face shield or visor or goggles. Now, if you're going to be in a place or in a setting where aerosols are going to be formed, in that instance, the mask changes a little bit. So instead of being just a surgical mask, we require something called an N95 respirator. So depending on the medical setting, this would inform exactly what type of personal protective equipment one would wear. And it's kind of like this outside of COVID in other times. Certain settings are more likely to involve aerosol generating procedures, and those settings are more likely to have N95 respirators as part of patient care. Similarly, different syndromes result or require different types of protective equipment. The same is applying to the different directives of different settings.
All right, finally, Dr. Parkes, I'd like to maybe just give you the last word. Is there anything you'd like to say to all the healthcare workers, everybody involved in this pandemic since day one, working so hard? What would you like to tell them?
Yeah, I just want to say that, thank you. We're all in this together. Any one of us can't do it alone. And I appreciate being able to work with such an incredible team, and knowing that, everyone has my back out there, and that together we're going to really help patients, protect each other, and get through this. And it is incredibly difficult, as you pointed out, because our entire world and everything that we think as routine and normal is being upended. So I think, having some sense of control going through the everyday, and knowing that, we're as safe as we possibly can be, is really important. And I thank you all.
Dr. Leighanne Parkes, infectious disease specialist, microbiologist working with infection prevention and control at the Jewish General Hospital. Thank you so much for taking the time. Really appreciate it. Thanks for all you're doing.
It's no problem.